Hello friends, myself Pratyay Bala Tultul. Now, today I again come with another topic of nursing research which is called ethics. Ethics. Ethics, also known as moral philosophy, is a branch of philosophy that involves systematizing, defending, and recommending concept of right and wrong conduct. The term comes from the Greek word ethos, which means character. Now, next come to the definition of ethics. The branch of philosophy that deals with morality. Ethics is concerned with distinguishing between good and evil in the world, between right and wrong human action, and between virtuous and no virtuous characteristics of people. Ethics seeks to resolve questions dealing with human morality. Concepts such as good and evil, right and wrong, virtue and vice, justice and crime, the rules or standards governing the conduct of a person or the conduct of the members of a profession. Ethics may be divided into four major areas of studies. Metaethics, about the theoretical meaning and reference of moral or propositions and how their truth, values, if any, may be determined. Normative ethics, about the practical means of determining a moral course of action. Applied ethics, about how moral outcome can be achieved in specific situations. Descriptive ethics, also known as comparative ethics, is the study of people's beliefs about morality. Nursing ethics. Nursing ethics is a branch of applied ethics that concerns itself with activities in the field of nursing. Nursing ethics shares many principles with medical ethics such as beneficence, non-maleficence, and respect for autonomy. It can be distinguished by its emphasis on relationship, human dignity, and collaborative care. Next, beneficence. Beneficence is a concept in research ethics which states that researchers should have the welfare of the research participants as a goal of any clinical trial. The antonym of the term maleficence, of the welfare of any research participants. Ethical principle. Ethical principles are autonomy, principle of the freedom. Autonomy is the basic ethical principle. An autonomous person is capable of making a rational and understand decisions about acting on these decisions. Belief in autonomy means that the client may make. Next one is beneficence, non-maleficence. Principle of goodness or rightness. This principle relates to the nurse's duty to do good and not harm. It is sometimes difficult to determine what exactly is good for another person and who can best make the decision about this good. Justice. Principle of fairness. Justice is the obligation to be fair to all people. The concept of distributive justice states that individuals persons have their right to be treated equally regardless of race, sex, marital status, medical diagnosis, social standing, economic level, or religious belief. Ethical principle veracity. Principle of truth telling or honesty. This principle is the most difficult to maintain. Nerds are obliged to be honest with client. The right of determination becomes meaningless if the client does not receive accurate, unbiased, and understandable information. Fidelity. Principle of keeping commitment and promise. Nurses' commitments to the client include providing safe care and maintaining completeness in nursing practice. Nurses also make promise to clients in overt way. For example, if the nurse agrees to be a resource person for the patient during crisis, she must fulfill this commitment. If she cannot be available, the ethical action is to discuss with the client and arrange a substitute when needed. These ethical principles are based on assumptions that all persons have certain ethical rights which are really privileges, concession, or freedoms. There are three types of rights: welfare right, legal right. Right based on a legal entitlement to some good benefit. Ethical right, moral right, that are based on moral and ethical principles. Option rights, rights that are based on a belief in dignity and freedom of human beings. Thanks for watching this video and subscribe my channel.